Edge Benefits podcast with our host, Tom Quigley of ClaimLinx. Tom, here we go. Let's rock and roll. Who's our guest today?
It's Kyle Fields, owner of ApproRx, which is a PB. Well, let him explain what that is.
Okay.
Yeah, definitely. I appreciate being here today, guys. And yeah, PBM, we're trying to make PBM back into a 3-letter word instead of the existing 4-letter word that it is.
So PBM stands for what?
Oh, pharmacy benefit manager or prescription benefit management. So it's tomato. Bottom line, our core of what we do is we are the claims processor, and I will say the middleman between the pharmacy and the payer being the employer or the third-party administrator, whoever's footing the bill for that particular prescriptions. And we're that little card in your pocket. So when you go to the pharmacy along with your prescription, and the pharmacy puts a hold on digital guts into their computer. When they submit that claim, it goes to a PBM like us, and we adjudicate that claim like a credit card, and we send it back, approved, not approved, covered, not covered, particular reasons why, along with all the copay structures. And so we manage all the pharmacy networks. So we manage the software, and we manage the billing process for employer-sponsored health plans across the United States.
So Go ahead, Neil.
No, you keep going. It's good.
So the frustration for a lot of the employees and the employers out there is the ridiculous costs of what they're paying for health insurance. And what they don't realize is all the hidden costs, particularly on self-funded plans. So you routinely go into these companies and show them how to cut their prescription costs and what's their hold up in terms of listening to you.
Yeah, so a lot of it has to do with the maintaining of the status quo. So a lot of times brokers get in the way of that, which to me, a lot of times brokers are added costs only because they don't bring a lot of value. Now, there's some brokers that are good because they do bring added value, but more often than not, we see them, the brokers just outsource their services to 5 other companies to pick a PBM. And the biggest issue is education. You ask the person on the street what a PBM is, and you'll say, I don't know, it's a peanut butter maker. So the average layman does not understand that everyone utilizes a PBM, in most cases by law under the ACA or Obamacare, but then again, they don't know and understand a gigantic line item in their business. They just ask, well, there wasn't any noise, and the cost of no noise is expensive. We always say healthcare is expensive, but it doesn't have to be. You just have to be a little bit educated on it, get the right PBM. We're going to make sure that, because no conflict of interest PBM, I should say. So we don't have any vested interest in what's filled, where it's filled, or how it's filled. Our job is to put our best foot forward as far as a formulary standpoint, or the formulary being what is on a plan, what's not on a plan, of what can be filled, and the coverage of those particular medications. We don't care where you get it filled. We don't have any conflicts of interest of any wholly owned pharmacies or specialty pharmacies or any branded biosimilars or anything like that. It's simply, I think this is more of an assembly plant. Like Ford and Chevy, they're not manufacturing plants, those are assembly plants, and they assemble the best parts that goes onto a car so they can deliver the best product. And that's what we do. Everything down to rebate aggregation, to our softwares, to our prior authorizations, to our networks, especially pharmacy fulfillment. We just partner with the right people so they're interchangeable. So if one screws up, the Cooper tires start putting out bad tires, and we need to be able to swap that out. It's very nimble.
So Kyle, here's my devil advocate question. Why are you different than the other businesses? Why don't you follow the same business model they're following? What's happening to those companies because they're not really working out for the...
The thing is, these companies, the big 3, I'll call them, they can do what I do, but it's a difference in philosophy. So with the lack of education, there's people just maintain the status quo, and my job is to educate. So I can sit there and tell you I'm a great PBM, and I do this, and I do all these special things, and I like long walks in the rain and drinks little umbrellas. But really, you got to speak the universal language of money. Everybody understands money. And then when you throw that into healthcare, then you're throwing in a little bit of an emotion as well. So the healthcare is very emotional. But then again, so is money. So you got to find that right balance between the HR department and the CFO department, that there's going to be some noise, but the education paired with the amount of money that's being saved compared to being with another big PBM where there's just wrought with conflicts of interest. It is vertical monopolies. The incestuousness of this business is remarkable. And APRO as a PBM, what we try to do is we try to break apart that vertical monopoly and make it not necessarily an a la carte in the sense where we let the client choose, but we give the client some options based upon our best education that we have and our expertise in the industry, knowing that since we don't have any conflicts of interest, we're not beholden to a particular drug, particular rebate, particular pharmacy, and it allows us to put the best product forward. And the savings, you give us a group with an Express Scripts, I can say I'm going to save you 30% without even looking at the data. And it's simply because of the difference in philosophy. People are taking drugs they don't need to be taking. And what I mean is that I'm not saying they don't need medication for whatever condition they have, is that if you just need to drive to the grocery store, why are we giving people Lamborghinis when a Toyota Corolla will do just fine and probably even do better because they'll hold more groceries? And that's what's happening, is that just because Family Feud has it as a sponsor on Tuesday nights doesn't mean it's the best drug in the marketplace. So we don't want to go down the rabbit hole of direct-to-consumer marketing, but really, you just need that watchdog. And what separates us mainly is we put pharmacists back in charge of pharmacy. And my pharmacy team, led by Dr. Jordan Mullins here, I would put up against any pharmacy team in the country because we don't have conflicts of interest. We're not bought. We don't get lobbied to because it's not our philosophy.
So why do you think these larger or any companies allow their office managers or HR directors to make the decision on health insurance when, quite frankly, in my opinion, they're not qualified?
That is a very good question. If it's not your money, then you go for what is the easiest. And that is not knocking an HR person. That's just human nature. And so you got to make sure that the people footing those bills, again, back to the language of money. Why do we complain about gas prices? Because it's posted on every corner across the country. So every time it goes up a tick or two, we notice it. Every time it goes down, we notice it. So we need to make that available to consumers, is that we need to make sure they know how much they're paying for their medications, what they could be paying for the medication, and then ask them, how much are you paying your PBM? Because that is a question that people won't answer, not because they don't know, it's because they can't. Everything's built in, everything's hidden. But there's a reason why these big PBMs are being purchased for 60, 70, 80 billion dollars, and their parent companies have 120 to 250 billion dollar market caps. And a lot of that hinges on prescription medication, because one of the shocking things out there is that the rebate industry. So last year, my last metric I looked at in 2024, there was $350 billion in drug manufacturer rebates distributed from manufacturers. And the conduit for those rebates are how much of those rebates actually made it back to the client? I would say less than 20%. So there's a lot of hidden fees, a lot of hidden costs. Congress tries to go after some of these things, and then in states as well. They do it unsuccessfully because they hire the lobbying groups of the big three PBMs to write and assist with writing that legislation. The government still uses the big three PBMs as clients. And also there's a lot of lobbying going on, a lot of money exchanging hands there as well. And that's no surprise. But to me, the best way to combat this is for the governments to see how much money they're actually spending. You stop using the big three PBMs. And there are other PBMs out there, ApproRx, that are billion-dollar companies as well, but do it the right way. And it's a lot about education. It's a lot about understanding the actual dollar that's being spent. So we got to post those dollars and make it as widely known as possible. I'll speak in front of anybody. Speak in front of you. I've been on national television live. Speak in front of a third grade English class if I have to. Whatever I think is the most effective in order to get this information out.
That's fantastic, Kyle. And Tom, that's why we're on this mission.
What he's saying in a nice way is the industry's corrupt, and here's how it's corrupt, and we have a solution for it if you care to listen.
I think
my words.
And his words are very blunt, aren't they, Kyle? But it's good.
Yeah.
It's truth.
Yeah, it's truth. And we just need to make sure the dollars do a lot of these talking as well, because every employer, the taxpayer is footing the bill. So the government is not their personal money. And then HRs, it's not really their money. So we need to make sure that, one, they're educated on that. Put their hands in the decision of a CFO along with HR, and then along with the CFO and people who are cutting those checks. Because the amount of money we are saving every day is newsworthy. It's shocking when I could take a $30 million drug spend and knock that down to 11. And I didn't do that by taking cancer meds away from kids. I did it by simply swapping out brands with generics, swapping out brands with biosimilars, making sure that what they're taking has actual clinical efficacy. I think clinical decisions are fiduciary decisions. And then make sure it's being taken correctly. And that is also something that's not really monitored. And it's shocking to how many medications are wasted. And each year, from mail order, from not being taken correctly, it's just basically we got to give some ownership back to the patient and to the person footing the bill.
All right. So Kyle, I guess basically the call to action is how do companies and I guess who do you want to speak to right now? Who do you want to contact you?
CEOs, CFOs, brokers who truly want to help make a difference with their clients and retain that client, because I'm going after them. And if I find out that brokers are not doing the best financial thing for their clients or the best clinical thing for their clients, I'm gonna circumvent them. I'm gonna go around, and my job is to get data. So data is everything. So anybody that can get me data that I can do an analysis on, and I can run my analysis now with our new softwares we've been able to develop and purchase, at least even we can run an analysis against 7 different networks in an hour or less. And an hour, I'm exaggerating on the high end. And it will show you what true money is actually out there, and also show you what rebates you're not getting. And we can give that report and say, look, did you receive $250,000 rebates last quarter? No, I didn't know there was a rebate. If you want to get your per member per month costs down, you need to actually take a look at your PBM. So data is everything. Get the data, and I'll show you the numbers. I can tell you everything. I love to show you.
Show them the money. That's for sure. Kyle. So where can we find info on you? Tom, any other question?
Well, I was going to say that Kyle, we team up. We use ApproRx in our solution. Kyle is actually a client, him and his employees, and we couldn't recommend. They're taking the same approach on drugs we take as on health insurance, and it's a lot like lobster. I'm sitting here in North Conway, New Hampshire, not about an hour 15 from the coast. If I wanted to, I could go out to the docks, lobster, and come in and buy it for a couple bucks a pound. But instead, if you go to the grocery store, you're paying $12, $13, and people are like, how? There's all these middlemen.
Exactly. Eliminate the middlemen. Eliminate the middlemen. So Kyle, my question to you is, how is it working with Tom and ClaimLinx?
Excellent. I know that the clients, as far as me being a client, we're happy. As far as, and good Lord, I've had some health issues recently, but with clients that we have, mutual clients we have with Tom, we know that they're being serviced. The best day at a PBM call center is a call center that receives no phone calls. And so rarely do we receive phone calls from any of Tom's clients. Typically when we do, it's usually human error from a pharmacy, and which is very common. But the feedback from ClaimLinx brand, from the people that he sends to us, is all very positive.
That's fantastic. And then what about with you just working directly with ClaimLinx, meaning as you're Tom's client?
Right.
Kind of give us a little bit. That's what I wanted to get. That's great. What you said about, yeah.
Yeah. Again, we're not a 50,000 live group or anything, but when we do have issues, I'll give a shout out to Bill. Bill handled my last situation to satisfaction. It was a hospital billing error, but Bill was contacting me constantly to make sure that I was getting what I needed to get done for him in order to get things rebuilt with the hospital. And I know that some other folks here, I know Jordan just had a baby, and we had some questions and everything. And so the people that we're talking to at ClaimLinx have been extraordinarily helpful for us. And even when I got on Bill, all I did was give some permissions, and then Bill said, Kyle, you can leave. And he called me about 2 hours later and had everything solved for me. And that was about a week and a half. So I'm just if they're doing it with us, I know they're doing it with everybody else.
Appreciate it, Kyle. Best place again for find info on you?
www.ApproRx.com. And you can check me out at Kyle Fields on LinkedIn as well.
All right. And go to ClaimLinx. And thank you, Kyle, again. Go to ClaimLinx.com. Schedule a call with Tom and his team today. Appreciate it, guys. That was the special simulcast Neil Haley Show and the Cutting Edge Benefits Podcast.